I've worked at the Cancer Center in Fond du Lac for 22 years, and it's really an honor and blessing to work here every day.
I believe I was meant to work here. I was a patient 11 years ago in this very facility. I had breast cancer and I was treated by Dr. Lundberg and all the staff. And when I had the opportunity to work here over 7 years ago, I was just so thrilled to do it. I'm here to help and guide and sympathize with all the patients.
As a radiation therapist here at the Cancer Center, it is my joy and pleasure every day to come to work. I feel that the work here is my mission that I was called to do. I love serving the patients. I feel inspired by them. They motivate me, they give me hope.
As a nurse at the Cancer Center, I like to bring a friendly face to the patients in need and bring them a smile when they need it.
I'm in women's healthcare, and I've had the amazing opportunity to care for women who are truly warriors of their disease and their cancer. I have found it truly amazing that they have been able to endure all of the stresses that come with life, including families, husbands, jobs, and all of the other truly nitty-gritty things that happen. And I honestly salute these individuals for their efforts and their will to simply survive.
As a pharmacist here at Agnesian, I'm fortunate enough to see our patients come in weekly, every 2 weeks, every 3 weeks, and have been able to become part of their family as they're part of our family. And as a pharmacist, I'm fortunate enough to be able to directly help these patients.
So it's quite a difference going from being a nurse to now being the patient. You never expect to get that cancer diagnosis, especially at what's still considered a younger age. And as a nurse, many times I've been thanked, by patients and families. Thank you for everything that you've done. You don't know until you become the patient how significant that is and how sincere and how meaningful it is to be taken care of by such wonderful healthcare providers. Everyone from the breast care coordinators at the beginning to everyone here at the Cancer Center, from the doctors to the nurses to the pharmacists to the radiation technicians. I thank you, and I thank you from the bottom of my heart.
A cancer diagnosis affects not only the patient, but the family. And I just wanted to let our families know that we are taking good care of your family member while they battle this disease.
Being a palliative care nurse working with cancer patients during this uncertain time brings me great joy.
Working at the Agnesian Cancer Center as both a receptionist and lab technician, it's a joy to see my patients come in each day. It can be a struggle, but they are warriors, and it's so much more than just coming to a job, it's coming home to a family.
The diagnosis of cancer is a real shock, but there's help all along the way. The courage and resilience of my cancer patients inspires me to make sure their overall health is the best it can possibly be.
As a registered dietitian at the Cancer Center, I enjoy working here because I get to be part of the patient's journey that's often difficult, and hopefully make their journey a little bit easier during this time.
I enjoy working at the Cancer Center simply for the satisfaction of helping others. We're very fortunate to be able to work with a multidisciplinary team. Everybody has something to offer to our patients as we try to help them to improve their quality of life.
As a cancer care provider, it's a privilege to work with colleagues, nurses, pharmacists, and technicians simply to deliver the best care that we could provide at the Agnesian Cancer Center.
Every day I have the opportunity to come to work and sit with patients on their journey to healing.
Mammography is a screening service that can lead to a diagnosis of cancer. We understand that this is a difficult time. We treat each person as an individual with a compassionate heart and a listening ear.
I'm one of 2 social workers at the Cancer Center. I've been here almost 10 years, and I love serving our patients and families because we help them at a time when it's scary for them. There's a lot of unanswered questions. They need comfort and they need reassurance, and I feel like I can help them with that.
Cancer is a journey from detection, prevention, all the way out to treatment. And you're not in this alone. We're out here to help. The reason why I'm doing it is because of compassionate care for our patients. And we'll be working well together, and we have worked well together with other patients. We love what we do, and it shows.
As a nurse practitioner, I deal with cancer patients on a daily basis, and I really love sitting with them and sharing time with them and listening to their issues, not only with their health and how they're dealing with this diagnosis, but also listening to problems they may be having with family and spiritual issues and also financial problems.
Oftentimes, when a patient is diagnosed with cancer, they have concerns on how to pay their day-to-day bills. The Agnesian HealthCare Foundation created the Carroll Highland Caring for You Fund to help with these necessities, such as rent, utilities, gas, and groceries. If you'd like to support our community patients, please visit agnesian.com/giving.